I want to talk about very brief history of modern medicine. The three stages beginning in late 19th century. We've gone through three major stages of the development of modern medicine. Okay? The first stage is called the germ theory of disease. That stage, okay, and started in late 19th century. Louis Pasteur, Robert Koch, and others in bacteriological research decisively confirmed the germ theory of disease and uncovered the cause of a host of diseases, including, here we're talking about infectious disease, including typhoid, tetanus, and diphtheria, along with the vaccines providing immunity. Alexander Fleming followed up these advances in 1922 with discovery of penicillin, the first antibiotic. Drug production became industrialized, which allowed a mass production. A tremendous progress in the development of internal medicine, anesthesiology, pathology, immunology, and surgical techniques convinced physicians to focus exclusively on the clinical medicine grounded in exact scientific laboratory procedure. Thus, the practice of medicine in the 20th century rested solidly upon the premise that every disease had a specific pathogenic cause, the treatment of which could best be accomplished by removing or controlling that cause within a biomedical framework. Later on, we'll talk about the triad, okay, the transmission of disease, right? So what it does, basically argues that there's this agent and environment and host forming that triangle. There's this vector, and all disease can be explained by that triangle, right? Transmitted from, let's say, agent to the host, either directly or through environment or through vector, right? And that view, from today's perspective and knowledge, we know that is limited. And the second stage is the return to whole person. By late 1960s, polio and smallpox were largely eradicated, and infectious diseases have been severely curtailed in most regions of the world. This situation produced a major change in pattern of disease, with chronic illnesses, which by definition are long-term and incurable diseases, replacing infectious diseases as the major threats to health, including CVD, right? Cardiovascular disease, diabetes, and some lung disease and liver disease. So that's what we call the epidemiological transition, right? Going on from infectious disease, prevalence of infectious disease to chronic diseases. And the causes are mostly social, behavioral, and social conditions as causes. And third stage is what we call the re-emergence of infectious diseases. And we're going through that stage, right? So in late 20th centuries and early 21st century, because of globalization, a lot more frequent travel across nations and across regions and communication, urbanization from countryside to the city and from city to city, right? Global warming plus possibility of bioterrorism introduces, this threat or possibility of having, predominantly infectious disease, and that's what we're going through, right? Health threat like COVID-19, HIV, AIDS, Ebola, mad cow, SARS, STI, a sexually transmitted infection, and bioterrorism. Okay. related to especially these different stages, we have different models, mainly two models of health. Okay, so ideal types of health and illness and treatment. They are biomedical model versus social medical model. And in general, in medical sociology and social epidemiology, we subscribe to and focuses on social medical model. Here, argument does not go against either. Okay, but emphasis is different in different fields, right? So in the biomedical model, we have illness, right? And what are the causes? We have noxious stimuli like virus, bacteria, and germ, right? As agents. Then we have what? Antibody or drug to reduce illness. Right? What about social medical model? So here again we have the illness. What are the causes? Under investigation, social determinants like life events, social status, and availability of resources. So how to reduce exposure, how to treat disease, social support, and coping. Okay. So let me present this table to summarize these two models. So we have biomedical model, then we have social medical model, right? And here we have different factors, right, along this axis. So perspective for biomedical model is mainly, biological and psychological even, okay? A social medical model is sociological, social as opposed to psychological, biological, and medical, because psychological is individual-based, sociological is group-based. Yes, so for the second one, approach, individualistic biomedical model, social medical model is social and group-based. We study health conditions as outcomes of groups as opposed to individuals. Causes under biomedical model, it's nature-based, right? Biological defect or exposure to an infectious agent. For social medical is nurture, social environment and social forces. Examples, so for biomedical model, like genetic flaws, germs, virus, personalities, right? Something that is innate, or acquired. Social medical model, for example, we can have social categories like gender, occupation, race, class, social roles like student, etc. Right? Study population. For the biomedical model, patients and clinical samples. For social medical model, we have defined the population and community sample. Okay, so this concludes my lecture for the first module, and see you in our next module.